in pain.
Micki Forrester spends her days in and out of a wheelchair. She's suffering from a nervous system disorder.
I'm gonna have to go sit down in a minute, guys.
Called complex regional pain syndrome.
It's the difference between laying in bed crying and getting up and going kayaking.
Since 2007, she's been in chronic pain because her brain reads pain signals from nerves that think she's injured. Dog Pip is by her side to let her know when she's about to have an episode of uncontrollable convulsions.
It just lets us have quality of life.
This rally at the University of Washington Medical Center is one of 4 statewide and even more nationwide to raise awareness of the difficulties patients with chronic debilitating pain are dealing with now that CDC rules on prescribing pain meds are causing doctors to scale down or eliminate opioid medications these people say they need to function.
The CDC has never seen my medical records. They have never examined me. They have no right to change my prescription. I have to be drug tested every month to prove that I'm not taking heroin and ecstasy and all these other drugs I've never even heard of.
Micki says she understands the new CDC rules came about from the national health crisis that has been emerging from the historic overprescribing of pain medications. CDC numbers show that more than 350,000 people died from prescription or illegal opioids between 2009 and 2016.
Believe me, I didn't want this disease.
But she says the new guidelines are too strict and put bureaucrats between her and her doctor. Q13 News reached out to several pain clinics around the region, and no physicians were available to comment. A group called the Alliance for Treatment of Intractable Pain says that opioid prescriptions are at a 10-year low, yet opioid deaths are at a 10-year high. So these people say they're not part of the problem and shouldn't be punished just because they're in pain.
I have had 11 back surgeries.
This is just some of the hardware they've removed from Maria Higginbotham's back. She has a hereditary degenerative condition where the bones in her spine are crumbling away.
So they built a cage around it.
Her pain is constant, and while her doctor has tapered down her meds 40% to where they were, she's afraid new state regulations that might come soon will make them be tapered even more. She says while she's never seriously considered suicide, she knows others in her predicament have thought about it.
A lot of people want to be here today, but some of them are in so much pain that they can't even get out of their bed. I'm one of those, but I forced myself, I dragged myself to get here. Patients aren't addicts!
The hope here is to raise awareness and get people to contact their state and federal legislators and the CDC to roll back some of the harsh restrictions people in chronic pain say they're enduring.
It's a horrendous life. There's no joy left in it.
I'm Tim Joyce, Q13.